Our final guest this evening joins us from the USA. Dr. Heidi Klessig is an anaesthetist and author. She was a founding partner of the Pain Clinic of Northwestern Wisconsin and was an instructor for the International Spinal Injection Society. After her husband was diagnosed with a brainstem tumor, she retired in 2007. She now writes and speaks on the ethics of organ donation and transplantation. Heidi is the author of The Brain Death Fallacy. Heidi, welcome to the show. What first started you on your journey in terms of studying what brain death really is?
Well, this isn't something I set out to do. This is something that sort of happened to me when I was in training. I had an unusual experience, and this experience never left me. And so later in life, when I had time to think and study and research, it became what I do today. Now I write and speak about brain death. So what is a nice girl like me doing talking about death? Well, I'll tell you how it started. When I was a young anesthesiology resident, I was coming in for a night call, and I showed up at the operating room desk, and the supervisor told me, "Klessig, glad you're here. We've got a ICU patient that's going to be an organ harvest. We want you to go up to ICU and get him ready." And it kind of shook me. I thought to myself, I think I heard a lecture about brain death somewhere along the line, but I really wasn't clear on all the details. So, I didn't want to look stupid. So I said to him, brain death. Is there anything different about this I need to know? And he just sort of laughed and rolled his eyes. He said, "You know how eager the transplant team can be. Just be sure someone has actually declared him to be brain dead." Okay. So up I go. And I found the young man. He was a young man about my own age at the time. He had been in a motorcycle accident. And yes, the neurologist had declared him to be brain dead. But when I went to look at him, he looked like every other ICU patient I had ever anesthetized, and in a lot of ways better than most, more stable. He had stable vital signs, a good heart rate, good blood pressure. He had great oxygen saturation. His skin was warm and supple. He looked really very good and stable, which was not what I was expecting for someone who was, being called dead. But at the time, I was being trained to think like a 20th century physician back in those days. And I went back down to the operating room, and I found the anesthesiologist who was going to be supervising me for the case. And I presented the facts to him. He said, "Okay, well, what's your anesthetic plan of care?" And at the time, I have to admit, I was so brainwashed, I believed what they told me, that he was dead. So I said, "Well, I think I'll give him a paralyzing agent, which is quite common, to keep him from moving during the surgery, because, surgeons get fairly cranky if the patient is moving when they're trying to operate. And I think I'll give him some fentanyl, which is a potent painkiller, which should blunt any heart rate or blood pressure responses that might damage the organs." And he looked at me and he said, "Well, that sounds good. Are you going to give anything to block consciousness?" And I was stunned. I looked at him. I said, why would I do that? Isn't he dead?" And I'll never forget the long look he gave me over his operating room mask. He said, "Why don't you give one just in case?" And he walked away. Well, something was not adding up with all this to me. In my gut, I knew something was wrong, but there was a lot of time pressure in the operating room. The surgeons are waiting. The operating room team is ready to go. So I, unfortunately, instead of listening to what my gut was telling me, I simply did what I was told. And I brought the young man down, and I performed the anesthetic that we had agreed upon. I'm very grateful at this point that I did give him a consciousness blocking drug, because I'm here to tell you he responded to surgery just like anybody else. He responded with the same heart rate and blood pressure increases to incision, to the bone saws. He required the same types and amounts of anesthesia as every other patient. And so this experience never left me. I mean, I always had the feeling I was part of holding a young man who still had his eternal spirit in his body down with anesthetic drugs, where the doctors basically dismembered him to death. And it bothered me. But because I jumped back into the fast moving stream that was medicine, I really didn't have the time or take the time to research further until later in life.
So how was brain, because brain death was defined in 1968, right? So obviously, a fair while ago in terms of how much, we're told medicine has supposedly gone on and progressed. Why was it introduced? And what essentially is brain death? And that probably sounds like a really stupid question, but how do you
Well, no,
determine whether someone is dead or not, I guess, if their heart's still beating?
right. Right. So this is the thing. I mean, it's 1968, as you mentioned. It's depending on how you look at it. It's a while ago. It's nearly 60 years ago. But in the realm of humankind, when we've been declaring people dead by the criteria that they become cold, gray, stiff, their heart and lungs and all their vital functions stop beyond any possibility of return. That's been the traditional definition of death. And it's something obvious to anybody. The smallest child can do it. I mean, it didn't used to take a doctor to tell you that you were dead. People defined death at home, on the farm, on the battlefield. It was accessible to everybody. But in 1968, 13 men at Harvard Medical School redefined death. They wrote a landmark article in the Journal of the American Medical Association called A Definition of Irreversible Coma. And what they said was that their primary purpose was to define a coma that they thought in 1968 was irreversible as a new criterion for death. Now, they had no facts, they had no evidence, they had no studies that people in a coma that up until that point had always been considered to be alive were now somehow dead. They only gave utilitarian rationales for this. They said that these people's lives were a burden to themselves and others, and that redefining them as being dead already would have the benefits to the hospital system of freeing up intensive care unit beds and facilitating organ donation. And, in fact, this redefinition was of great utility because it allowed organ procurement to skirt the dead donor rule by simply declaring people in a coma, certain people in a coma, to be dead already. Now, the dead donor rule is not a law, but it's a universal ethical standard. It says people must neither be alive when organs are removed nor killed by the process of organ removal. But if you change the definition and redefine these people as dead, now you've met the dead donor rule by sleight of hand.
That is extraordinary. Is organ harvesting without, which just that term freaks me out. I'll be honest, like harvesting, even that just sounds kind of quite sinister. Without full consent, it's robbing families of their moments with loved ones, final moments and stuff. And also, it's kind of, for me, I'm thinking, maybe because I'm an eternal optimist, there would always be that part of me as a family member. But what if they woke up going forward? Well, what if? Do you know what I mean? Like
Yeah.
that guy with the motorcycle accident. What little I know about it, I'm thinking, well, what if he'd woken up in 6 months or 6 weeks or 6 years?
And in fact, people have woken up from a bona fide, correctly made diagnosis of brain death. And that is the thing that motivates me. I mean, what people aren't told is that doctors, lawyers, scholars, philosophers have been hotly debating whether brain death is in fact death throughout these almost 60 years in the medical and academic journals. But the public is never told this. The public is given, shall we say, propaganda? Shall we say slogans? Give the gift of life, be an altruistic person, don't take your organs to heaven with you. This sort of thing is all they're told. They're not told that people have woken up from a bona fide diagnosis of brain death. And in fact, in 1998, a pediatric neurologist, Dr. Alan Schumann, published a paper showing that he had found 175 cases of people who had been declared brain dead, yet who lived. One ultimately lived at home with his mother for 20 years. I mean, these people are in no way dead, and that's the problem. And I find it really disgusting that people are taken advantage of in their most vulnerable moment in a hospital when they have a loved one with a severe neurologic injury. And I'm here to tell you not all of them, of course, will recover. But I do object to taking people who are neurologically disabled and vulnerable and using them as a source of spare parts.
Do you think that's what it's about fundamentally? You know, the money of it. Like you quoted obviously the doctor at the beginning of our chat, where he's basically saying, you know what the organ harvesters are like. They're straight in there because obviously, you know, people that are desperate for an organ are going to pay a lot of money. And also, if you get that person off of the life support machine or out of the ICU, then that's a bed freed up for another customer. Do you think that's what it's about?
You know, I think, certainly money is a factor. We just had a actuarial company in the U.S. that came out with their report on organ transplantation. And if you run the numbers, I mean, the transplant business in the U.S. is about a $60 billion a year industry annually. So money,
Wow.
yes, but I think also people, a lot of people are fairly utilitarian in the way they look at their fellow man, and they think, if your life is not useful, probably you don't want it. And there are people who, maybe we could use your parts and give them a few more years of life. So there's a utilitarian ethic too that people look at. But the telling thing is, I have a quote from Dr. Elko Vidic, and he is a doctor at Mayo Clinic. He is author of all three American Academy of Neurology brain death guidelines. And he was speaking in 2006, and he stated quite bluntly, he said, the diagnosis of brain death is driven by whether there is a transplantation program or whether there are transplantation surgeons. I do not think brain death examination now in practice would have much, if any, meaning if it were not for the sake of transplantation. I mean, these people are in no way dead, but they are a great benefit to the transplantation industry.
It's almost like you're talking about a car, isn't it? Do you know what I mean?
Mm-hmm.
It's like, I've had a prang on the car. It's not worth it with the insurance and stuff, but I can probably, sell off, the tires, the 4 tires, or, oh, yeah, go on, then just chuck it in the scrapyard. It's really strange, isn't it, when you're talking about a human being, a life. You wrote a book called The Brain Death Fallacy. What inspired you to do that in terms of, because obviously, I know obviously you have an interest in it, of course, given your experience and stuff, but writing a book is a big undertaking. So to go, do you know what, I'm going to sit down and write a book on that. This is how important this is.
Well, the thing is, I sort of wanted to clear myself. I had this feeling that I had been part of a medical murder. And I thought, surely if I research the facts, maybe I'm not guilty of this. And so I was actually hoping to find out the opposite of what I learned. And so, yes, I am guilty of being part of a medical murder is what I learned. I went back through the history and I found, as we mentioned, that this was a change in definition. It wasn't a scientific fact. We found, as I wrote the book, that there were people who were writing laws and then later were telling the reporters, I actually fudged when I said that. I really thought the whole idea was nonsense, but I was under a lot of pressure. And so I made the facts seem kind of fuzzy. And so even the people who were writing the brain death laws in the US, some of them were admitted later that they didn't really think this was death. And then I found the research actually completely shows that these people are alive. The only multi-center prospective randomized study of brain death that was ever done with autopsy findings. They took and autopsied the brains of people declared brain dead, and of 200 odd brains that they looked at, 10 looked normal, and less than half actually showed total brain destruction. The great majority did not show the type of a destruction that you would think would mean death. And the authors of that study said that our study has shown that brain death is a prognosis of death. Death is certainly a very likely to occur, but it has not yet occurred. And so people ignore studies like this in this great drive to continue with the exciting, glamorous transplantation industry that has come to pass. And so as I went further, I found many stories of people who actually woke up, and some of them have returned to normal lives after a brain death diagnosis. Zach Dunlap is a very famous case in the US. He was a young man who had a head injury after a four-wheel ATV accident. He actually had a very serious injury. He had brain tissue coming out of his ear. But after they declared him brain dead, his cousin, it wasn't his medical team, but his cousin took issue with the fact that they were about to harvest his cousin's organs, and he gave him a painful stimulus on the bottom of his foot, causing Zach to withdraw his foot. And he called the nurses over. Look, my cousin is moving. And the nurses said, well, in brain death school, they tell us, that the people can still be moving, but they're dead. And so his cousin gave him another stimulus, and Zach pretty much took a swing at him. And they said, oh, well, that movement crossed the midline. Now maybe that movement is a real conscious, intentional movement. And so the procedure was called off, and Zach went on to make a full recovery. But the really horrifying thing is Zach related then, after he had been given a chance to recover, I mean, the helicopter was landing with the team to take his organs. It was that close to happening. He related later that he could hear every word that was being spoken about him. He heard the doctors telling his parents that he was brain dead, that they had no chance of life, that they should make him an organ donor. And he said, I was powerless. I could not move. I could not sign. I couldn't let anyone know that I was listening. I felt so angry and so helpless. And that's the really horrifying thing, especially when you learn some anesthesiologists do not give these people a consciousness blocking drug during the procurement surgery.
That's something from nightmare. Like I used to suffer a little bit from sleep paralysis, where I was kind of aware, but no one was trying to harvest my organs. That I can't imagine. That's extraordinary. You've got a website called respectforhumanlife.com. Is that where people that are watching this that want to learn more about this? Because I have no doubt that this conversation, as short as it is, has opened people's eyes a little bit. Like this is, is that where they can go and find out more about this?
Yes. And so if they go to respectforhumanlife.com, they can look at, we have the articles linked. We've got the different types of transplant linked. And, honestly, I'm not against every kind of transplant. I mean, people who are doing living transplant in which both the donor and the recipient remain alive after the procedure, that's a wonderful way to give somebody who has an organ that's failing another chance at life. So things like a lobe of a liver, a kidney, actually any organ except the heart, of course, can be given via a living donation. And these are some of the most long-lived and successful donations. And as far as the heart is concerned, the good news is that a totally implantable artificial heart is currently in clinical trials. So we need to work and pursue more ethical ways of helping people with organ failure, and we need to get people the facts. And so that's why I have respectforhumanlife.com, is so that people can take the time that they need to read and learn about these facts on their own.
Fantastic. Heidi, thank you so much for joining us. I'd love to speak to you again in the future. As more stuff comes out, as I'm sure it will, the more it's exposed, then it becomes a bit of a snowball, doesn't it? So so that would be wonderful. But I really appreciate your time, and I really appreciate you getting up early in the morning to talk to us as well.
Thank you for having me.